Okay, since this is being recorded, I'll go ahead and get started. So we're going to go over the forms editor today. I'm going to skip kind of the whole entire forms section here for the time being, but I will go over it in a separate webinar next week. So the first thing I just wanted to mainly touch on is how we can create these forms. So from our forms page, you're going to select the forms on the left-hand side. Here you're going to be able to see all of the current forms that you have available. Now, this is a test site, so we're going to have a lot more than what you might see on your end. A couple things that you'll notice from this page is we have create new. We have all of the forms. We have whether it's a default form or whether it's also a minor form, whether it's in a package, the frequency of the forms, whether the form is required for any specific services, and then the folder that the form is going to save in to. And then lastly, some action items. Now for this purpose, all we want to do is go about how to edit the forms and how to create a new one. So let's say, for example, I have this default appointment cancellation policy form. If I click into this, it's going to take me to what we call our PBN form editor. Now here we'll have our default, information, and any of this can be edited to your needs. So if for some reason, my policy is not 48 hours, but 24 instead, and maybe I charge a fee of $50, I can click into this, and then you'll see it brings it up in this panel on the right-hand side. Here I can scroll through and make my changes. I'll want that to be in bold, so I'll click that. And then I do $50. Let's see, there's also here $50. I will then click save. And now you'll notice that my changes appear in the form. So now anytime this form gets sent to a patient, they will see the latest updates that I've made. Now I'm going to go back out, and I'm first going to create a new form since I'm going to walk you through creating a medical history form. So we're going to select create new. We're then going to be brought to this screen, and I'm going to select create new again. Now I can create a form by copying an existing form if that might make it easier. If let's say you already have a dental history form and you just want to make some edits, remove some sections, copying it from an existing form might be your best option in this case. But if you just kind of want to start from scratch, you can click blank form. So this is what this blank form is going to look like. Up at the very top, you're going to want to name it. So here we're going to do medical history. If you just click outside of that window, you'll see that the name gets updated. This is going to be your main editor page. You'll also see an option for settings. So here we'll have our default page. You can select some specific toggles here. So if you wanted to allow copy from family members, if you toggle this, then if anyone has other patients that they're responsible, so let's say they have their kids and they need to fill out any specific forms, any information that is the same from one form to the next can just be copied over to that family member's forms. So if you want to allow that for a specific form, you can turn that on here. You can make this a default form. You can require that the doctor sign these forms once they're completed. You can also add tags to the form. You can set when it's required. So if it's manual, which means you would send it out to the patient. If it's once, they would only have to fill this out once. whether they have to fill out every time or every 6 months, every 12 months, every 2 years. You can select that here. And then similarly, if you want to only send this to certain patients that are receiving specific service codes, you can set that here as well. If you've created, once you've created your medical history form, you can also make a minor version. Now, I would hold off making the minor version until you've created the form specifically as you've wanted it, because then you can select this minor version and it'll just copy your default form, but you can then go in and edit some information that may only be relevant to minors. So that is an option that you would do once your form has already been created. And then lastly, we have history. So it won't let me click it right now because I haven't made any changes, but the history is just going to allow you to see who within the practice has made any updates to the form. Now let's go back to our editor. The next thing you're going to see is default. If I click on this, I can change the title here. So this gets seen once the form is sent to the patient. They'll see this as the title of the form. So just to be safe and make sure that they don't see something that says default, I just go ahead and add the name of the form here as well. Next, we'll see the first page that we're working on. So by default, it's called introduction. If we want to change this, we can do that here. Now just keep in mind that the patient does see this. So if you want to name it maybe patient info or whatever is relevant to what this first page is going to be. So then you'll see patient info, number 1, since it'll be the first page. And then if you wanted to add additional pages, you can add pages to the left and pages to the right. So as you can see now, patient info moved to number 2. And this one is, let's say, medications. You can also delete these pages. And then the settings is just going to allow you to change the patient info here. And then you can also add the Spanish translation of these names as well here. So if you need to send forms to Spanish patients, that way all the information is translated. Now our default forms do have translations, but any custom form will need to be translated or you will not have that Spanish version. So just keep that in mind. Now I'm going to delete this one page here. We're just going to work on this patient info first. So the first thing you'll see here is it says add a row to get started. You'll click on this and then you can choose what your layout of your page is like. So if you want to have 1 column, it would look like this. If you want to have 2 columns, it would separate it out like this. So you can have questions on this side and questions on this side. Or you can even do 3 columns if you want to add questions in a more condensed format. So for this purpose, I'm going to stick to 1 column so that we don't condense it too much. The next thing you're going to see is add component and widget. So if I click this, we're going to get this pop-up here. Now this is going to be everything that you can choose to create your form. We have header. So this will just be, a title for each section. If you want to do patient information and click save. Next, you can also do selection header. So this would be a smaller header. If we click save on this, we'll then also have an option to add some selections here, but frequently the header is more used than the selection header, but you do have that option. We can also do a paragraph. So this is going to be kind of where the larger portion of your text is going to live. Similar to what you just saw on that cancellation policy, you can enter all of that here. Okay. You can make changes to the text from here as well, sizing, all of that. So any large text would be under paragraph. You can also choose to upload an image. So let's say I have a pre-selected image that I want to use. I can click that here. I can change the sizing of it. I can hit save. And then here I can also continue to make some edits. So if I want to align it to the left, to the center, to the right, I wouldn't suggest changing the height from here just because it's going to really drastically change the way this image looks. But you can change the width here, and it just makes that a little bit smaller, makes it bigger, whatnot. So we're going to delete that for now. You can also add a text box. So if anyone needs to respond to a question, this is what you would use that for. If, let's say, you want to make the question a little bit longer, where the answer will be a little bit longer, you can use a text area instead. As you can kind of see, it gives you that bit of a larger space for this. We can also use a number box if you are entering any number values, phone numbers, things like that. You can do a select box if you have, maybe you want someone to choose between a couple of different options. Question-wise, you can add those options here under select. We can do a checkbox. So this is beneficial if you need the patient to agree to something. We have some radio buttons, which is similar to select. You would add all of those options here, along with the question. We have a date picker. So if you're trying to request, a specific date from a patient, you could use this. We have the signature page. So if you need to require a signature from the patient, we can have yes or no options. You can add terms and conditions. You can also select an image upload. This would allow the patient to upload an image of their choosing to the form. We then have medications, allergies, and diseases. Now, these sections correlate with your lists that come from the forms page, which I will go over once we create our custom form. But if I were to select medications, you would see automatically that I have a couple options to choose from. So once I've named it and saved it, you see all of these options automatically come in. Now these come from our lists. And the purpose of the lists is so that if they're selected and you have them properly mapped to your practice management software, the patient's chart will be updated with any of the options that they select from this page. They can also click no medications and whatnot, but keeping it structured to this format would just help update those medical alerts. And similarly with allergies and diseases as well. We have a referral block, so if the patient enters a referral, that will write back as well. You can request their address. If you have credit cards and payments enabled, you can also do a payment method block. This allows the patient to enter their credit card information for it to then be saved into PBN. Now we only save, you'll only be able to see the last 4 digits just for security measures, but that's a good way to keep track of payment methods within your practice by numbers. You can also select patient name so that this will be the patient's first, middle, and last name. You can also edit this, but this just ensures that the patient's name is automatically entered when they go to fill out the form. We have a gender block, date of birth, patient profile will allow the patient to upload a photo of themselves. And then we have custom block isn't active at the moment, but we do also then have a separator block, and it just creates these nice separations between any questions or sections that you might need. So now we are going to create a form based off a previous form. So let me bring this up. Okay, so it might be a little bit hard to see. I do apologize, but hopefully we can follow along with this. Now this is a dental medical history form. And now we're going to just go ahead and walk through creating this exactly as it's been created. Thanks, Kathy. We'll definitely keep that in mind. I do apologize for that. But hopefully you'll be able to use this one going forward. And if you have any other questions, we can definitely chat about it offline as well. So the first thing I'm going to do is give myself a header to this page. So here we have dental history. The next thing I'm going to do is do my patient name block. Here you see it's a little bit different than this, but I can always change that. So I don't have a middle initial, so I'll delete that one. Now it changed the width here, but let's say I want to make this 100%. I can do that, and now you see it looks exactly as it does on this form. I'll leave this as required because I want the patient to have to enter this information. Now I'll also check read only, and this way when the patient does go to fill out the information, they won't have to enter it. It's just going to see that this is their name based off what we have saved within our practice management software and PBN. And then down here, we also have a default data source. So we have a couple different options here. As you can see now, this is just going to mean that it's going to save into your practice management software. And then you can change these. You can also add custom ones in certain sections. So if you have, a specific source that you want to be able to write it back into your practice management software, you can create, you see right here is custom data source. And that way you can kind of create your own version of what we have here. Even though we do have a lot of options, you can definitely create your own. Next, we're going to add our, we want the date of birth block. And then here we have some options as well where you can either allow past, allow today, allow future. I mean, ideally, they probably wouldn't be born today, so we can always remove that or leave it as is. And then just be sure to also save periodically. You don't want to lose any of this as you're going through it. All right, next we have a select box. So we'll go here and go to select. We'll then enter our question. So why are you changing your dentist? I can enable an other option. This way I don't have to enter it. And then here I'll add my labels. So change of residence. My last dentist retired. I won't add all of them, but you get the idea. Your office is closer. I don't have a dentist. Previous dentist, that is. And then we'll hit save. All right. A little tricky here. And now you see my options here. Now, if we want it to look like this, I can do multi-select. And now it will allow them to choose multiple options instead of just one. Let's say I wanted to get more of an explanation if they were to choose other. I can then add what we call a condition to this question. So if I select add component, I can then select add child component. And then let's say we want more details if they click other. So I'll do a text box in this instance and I'll ask, please provide more details. And then I will set a condition. So this condition is just going to mean when does this question come up? So it's going to be a part of this, why are you changing your dentist question? And then if the answer contains, let's see, so since we want it to be other, we'll say does not contain any of these, right? So that way, if they choose other, it's going to bring up that question. And then we'll hit save. And now if you hover over this, you see that this question is has a condition. So it's just to mean that if they don't choose any of these, but only select other, then this question will pop up for them to fill out. Now let's go to the next one. The next one is a yes or no question. So we'll select yes or no. We'll then do you feel anxious? And then yes or no are already our options. And we'll hit save. Yes, so you can make these questions required for patients. So as you can see, any of these questions with an asterisk are going to be required, meaning the patient can't move forward unless they answer these questions. Now, let's say if do you feel anxious is not something you necessarily need to know, I can remove that and you'll see the asterisk is now removed and the patient will be able to just skip over this question. Okay. Next, as you can see, we also have a couple other questions here. These are all going to be select, but just for time's purpose, I'm just going to go ahead and scroll through a bit. I don't like the way it does that, but as you can see here, this has that allergies section. So let's say I want to add a separate section. We're going to go to medical history now that we've asked some of these questions. So I want to add another section just to kind of separate the way the form looks. I'm going to click this second box out here and then choose another layout. So I'll do a column. Now I can kind of differentiate between dental history and then what I'm going to label medical history. Okay. Now the first question we have here is, are you under the care of a physician? And this is also a yes or no question. I will keep it required. And then I'm also going to add a conditional question below that that says, please add your physician name and contact information here. Now, this question would only be relevant if the patient says yes. So we'll go ahead and select add component again. We will do a text box and say, please add your physician name and contact. Now, I'm not going to make this required because I just want it to be required if they say yes, but I will go down here where it says available if. I'm going to click this. We're going to do add a new condition, and then you're going to select, are you under the care of a physician? Now, if it is yes, which is what we want, we'll select add filter there. So now, are you under the care of a physician is yes. This question will now appear to the patient as well. And as you can see, if I hover over, it has that condition set. Now, a couple other things that you can see here as well are some options to either move the question around or duplicate it. So in this instance, since I know I'm going to ask another yes or no question, let's see what we have here. Okay, I'll take a look at your question at the end, Kathy. So let's say I want to add another yes or no question, and I know that's what's next. I'm going to go ahead and just duplicate this, right? Well, I'd have to duplicate it without having the condition there. So let's say, let me show you that here. I'll do another text box where I say, have you ever been hospitalized? And we've got that yes or no there. Now, without having that condition set, I can definitely duplicate this. And then I can just change my question here. When you add the condition, it makes things a little bit tricky to duplicate, but just know that that is an option before we add those conditions. So then again, I will add my component. Please add any details here. And we'll add our condition. And we'll say, which one was it? This, because I added it as a text box when I wanted it to be a yes or no question. So we'll do yes or no. We'll save that. And then we'll add our condition. And this might not require detail, so we'll just move that is required, just in case the patient doesn't have anything else to provide. And then we'll add our condition, which is to set it at if it's filled in with yes. Awesome. Now, another thing I can do here is I can move these questions around. So let's say I want, have you ever been hospitalized to be first? I can select this and then just drag it up until I see it appear in this blue section. Once I let go, you can see this question has now been moved above the previous one. Or I can move it back. And now it's in the original form. Now let's say the next thing I want to do is add my allergies and medications. I'll scroll through here and select medications. And then I'll say, please list all medications. Or please select all. Let's do that instead. And then you can see all of the medications we have from our list are shown here. Now let's say I don't need to add anything else. This is kind of what I want it to be. Click save here. And then the next thing I'm going to show instead is going to be okay, now that we're back here, let's say I want to just add a signature box and close this off. I'll ask for a patient signature. Make that required. And then the patient will sign if it's for themselves or for a guardian. Now, again, I can move any of these around. I can duplicate it. I can add child components. I can also add a component above or below it. But typically, I like to just add them within the section. That way, whatever the answer is, the next question just kind of comes right after that. But that's definitely up to you and how you want to do that. A couple other things I wanted to mention, or even just to show you, if let's say maybe you don't want the signature to be on this page, you can always add it as another page. So I can do a separate patient signature page. Click save. Do our column and then add our component. So then I can come back to my patient info and remove that there so that this way the patient will go to a separate page to fill out that signature section. Okay, let's see. When I send multiple documents to a patient at the end of each one, there's a warning that pops up from that says this form can't be updated after submission, yes or no. This one might be a little bit specific just based on your setup, Kathy, so we can kind of connect off of line as to how your forms are set up. Okay, now let's say I've saved this and I want to have a minor version. I can create a minor version from a blank form, or I can say copy form from default. I'll click save. I can then go back to my editor and then I can see my default form and my minor form. And then from here, I can just make any changes to the already created form without having to just do a completely new one. And this way I would just tailor it to what is specific to that minor. And then for each component, as you can see, there are a couple different things. If you hover over these question marks, it gives you some more answers as to what they do. But just keep in mind that this conditions is available if, so that's important when you're adding those components. You can also make certain questions be conditionally required. So if, let's say, this will give you those options here. So let's see, I can probably do it on this one. So if I do conditionally required, I can do add a new condition. And then let's say I want to select, do you feel anxious? And then select is yes. Now in this instance, it doesn't really make sense for this question, but just so you are aware of how it works, if the person filling out this form selects do you feel anxious as yes, then this form will be required for them. Let's say if you don't have it required already. So that's kind of what these sections do. Available if is more commonly used, and then conditionally required and conditionally disabled is more of a nuanced format for your questioning, but you definitely have those options. Now, one last thing I wanted to show you is this list section. So as I had mentioned, all of your medications that we saw on the form when you clicked medications is coming from this section here. You can see all of the medications that you just saw on that list. You'll see the PMS mapping name. So anytime someone selects Coumadin, it'll appear in their chart like this. You can always change this, and you can edit these names within your practice management software as well. Now, if you don't want this to be an option, you can always hide it. So you can deactivate it from this list, and then it won't appear in that medications. So right now we aren't, if you have a form that's already in use in PBN, you can like switch them around and share them between practices. But you can't necessarily upload just like your own form immediately. You'd have to kind of what I just showed you is go through an existing form that you might have on paper or as a PDF and create it from scratch that way. And then here you can also edit the name of your medication and edit that PMS mapping as well. From here, you can also set custom questions. So if someone chooses any of the medications on this list, you can add, for example, ask about dosage. So if someone clicks one of those medications, the next thing that pop up is ask them how much the dosage that they're taking is. So that's what this custom question section also is. And then the same goes for diseases and allergies. If you click on those sections within your form, that is what you will see here. And you can't edit these built-in categories, but you can add your own categories as well. And then, like I said, you can hide any of these if you don't want certain ones to appear on the form. You can't delete the built-in ones, but you can delete custom ones. And then again, you can edit the allergies, give them a Spanish name, and so forth. But any questions about how to edit forms or how to add any components, move things around? This was kind of a basic refresher, but I'm happy to have any sort of one-on-one conversations and walkthroughs with anyone that might have further questions on, specific form generations. Yes, and here in the chat, if you need help with any of these, you can definitely reach our support team. All right. I will be uploading this webinar to the Learning Center for you to view at a later date. If you have any questions, feel free to reach out. I will also send a follow-up email with some resources and any additional information that might help you in creating your new form.
Thanks, Alyssa. This was great.
Awesome. Have a great day, guys.
You too.
Bye.